Today we're going to be discussing the global health crisis that is air pollution. Air pollution kills an estimated 6.5 million people a year globally and places a massive strain on health services, productivity and economic activity. It also fuels the global climate crisis, which has further health implications. Speaking today will be Nick Watts, the Executive Director of the Lancet Countdown to 2030, which tracks and drives progress towards a world which is responding to climate change in a way that protects and promotes public health.
Thank you very much for having me here today. I'm just providing a little bit of an overview of sort of three issues in their intersection: climate change, air pollution, and human health. I'm only going to talk for 5, maybe 10 minutes and then move on. But if there are any other questions, then very happy to answer them. And I'm talking principally from the perspective of research collaboration based out of the medical journal, The Lancet. Is sort of our equivalent of the health professional sort of equivalent of Nature or Science that looks at these links. So when I took a quick look at the participants on this call, I perhaps thought that for many of the people here, talking through some of the health impacts of climate change isn't going to be particularly relevant, because there's probably quite a few people that are relatively knowledgeable about this. But to cover it off quickly, at its most basic level, the links between public health and climate change are centered around the fact that sort of environmental and social systems are inextricably linked. And whilst this is something that public health professionals have understood for a very long time, I think over the last sort of 2-3 decades, that had been forgotten. What climate change does is sort of remind us that in every way, the environment links to all of the various social determinants of health, and rapid changes in the environment, climate change or other forms of environmental change, often do sort of particularly concerning things to human health. As it turns out, human physiology and sort of society don't do a particularly good job of managing change. They like things that are stable. So when we talk about the health impacts of climate change, we broadly split them up into 3 fairly unhelpful ways of thinking about it: direct, indirect. Direct impacts, so these are impacts that sort of you see on the far left there: extremes of weather, drought, flood, heat wave, all with their attendant health consequences down the other side. So when we're talking about flood or extreme storms, we talk about direct injury, we talk about depression, PTSD, rise in incidence of generalized anxiety disorder that follows some of these extreme events, but also perhaps more in lower middle income and low income countries, where you start to see a breakdown of sanitation systems following some of these events, a rise in waterborne disease, waterborne infectious disease as well. The sorts of numbers we're talking about there by the end of the century, sort of, some of the best predictions from our work is looking at an additional 3 billion exposure events per year for vulnerable populations for heat wave, an additional 1.4 billion exposure events for drought, an additional 2 billion sort of extreme rainfall exposure. This is a sort of a multiplication factor of somewhere between 8 to 12 for each of those extremes of weather. Down the other side, the indirect effects, these are effects that are created through social or environmental systems. And so there we see sort of the follow-on, and this is where we start to talk about things like the spread of vector-borne diseases and other infectious diseases, where we start to talk about what happens when prolonged drought leads to decreased agricultural yields, sort of subsequent malnutrition, stunting, and the sorts of numbers you talk about around there get relatively high, and probably more concerning, looking at sort of, an additional, one of the studies that we put out a couple of years ago, an additional 9 million children stunted in sub-Saharan Africa, additional 7 million in Southeast Asia by 2050. Unfortunately, that stunting is something that you live with. If it sort of comes along in the first sort of 3 to 5 years of life, it's something that that sort of has health consequences right the way through your life, results in ultimately much earlier death, but a whole range of other sort of all-cause issues. I'm full of relatively unhelpful pictures. This is another sort of similar diagram that talks through the various health impacts of climate change, and I won't touch on all of them. One of the things that I think this diagram reminds me to sort of think about is the fact that when we're talking about climate change and its health impacts at a local level, we are never really just talking about any one of these things happening in isolation. We're not really talking about just flood. We're talking about flood coming back in greater magnitude and frequency again and again, combined with a new infectious disease, a new vector-borne disease that previously wasn't there, combined with the impacts that that flood had on agricultural yield. And so you're talking about sort of a multi-hit scenario. And one of the things we know from the human body, you knock out one organ, you knock out part of the kidney, and the liver can usually do a good job of accommodating. You start to knock out sort of more than one system, and you very quickly spiral into decline. And it's that sort of threat, that multi-system sort of threat that comes back again and again, where you start to wear away at sort of social resilience and the ability of a healthcare system to respond and protect the public health of its patients or of its public. That's what gets you, I think, particularly concerned. So some of the work that we sort of do comes to some pretty alarmist, I suppose, if you want, conclusions, but we had some very serious discussions with some very serious people, and they felt that it was probably irresponsible to say anything other than some of these three sort of summaries when we're adding up all of those multi-hit scenarios. The health impacts are potentially catastrophic for human survival. They threaten to undermine the last century of health gains, and indeed, contrary perhaps to some of the ministers in the United Kingdom, a medical emergency. So from one health challenge to another, taking what might seem like a tack to the left, I thought quickly to talk about air pollution. Mostly when we talk about air pollution, we are talking about very fine particles, smaller than sort of 2.5 to 10 micrometers. We are talking about heavy metals and various other sort of gases and emissions, like compounds of nitrous oxide expressed as sort of NOx or as sulfur dioxide. Depending on the country that you're sort of talking about this air pollution in, the source and the exact sort of breakdown of what kinds of particulates and emissions you're talking about vary, but at the sort of broad average level, as Greg said, 6.5 million equivocal sort of attributable deaths to air pollution, with a weighting towards those from sort of household air pollution, so indoor air pollution. Exactly what those deaths look like, it's anywhere from a range of different cardiovascular diseases, myocardial infarction, and sort of consequential heart failure, peripheral vascular disease, cerebrovascular accidents like stroke, and then respiratory disease makes up sort of about a third of what's left there, looking at sort of childhood pneumonia, exacerbations of chronic obstructive pulmonary disorder, asthma, and also building on some of the existing COPD there, and lung cancer making up sort of the remaining 10% of that global burden. There is emerging evidence, although I'd like to stress that it's emerging on sort of the population-wide impacts of air pollution on various developmental origins of health and disease, on obesity, on premature birth, on diabetes. Most of this is so when we're talking about the sources of this air pollution, like I said, it depends on the country that we're looking at. In high-income countries, I'm in the United Kingdom at the moment, and there's a heat map of NOx of London down in the bottom right of the screen. We're principally looking at transport, the transport system being responsible for the majority of the air pollution. And as a result, you can see that the air quality maps map fairly closely along the transport veins of a city. I'm talking in very sort of generalized terms, middle-income countries principally looking at electricity generation and industrial processes, heavier metals. The reason why a city like London doesn't experience that is mostly because it's moved industrial processes and electricity generation out of its population centers. And then finally, low-income countries experience all of the various burdens, but more than anything, household air pollution. So this is the pollution as a result of cooking, heating. So those are the two threats: climate change and air pollution on human health. Moving on though to I suppose the solution space, and this is sort of looking at some of the work that we do. I suppose the point I really want to make here is that the solution space is enormous. So there are common sources between both of these, principally within the energy sector. So that includes electricity generation, energy use in buildings, so houses, industry and transport. It's responsible for about 2/3 of total greenhouse gas emissions and produces the vast majority of particulates, SOx and NOx and VOx, sulfur dioxide, NO2 and volatile organic compounds. Which is the predominant source of air pollution. Some of the work we do here tracks a lot of this and tracks some of the health co-benefits, tracking sort of coal phase out and the subsequent health savings, so the lives saved as a result of that. The sort of numbers you get end up being very, very substantial. And so I'll skip through this here and come on to the sort of final case study, which is the example of where tackling air pollution and climate change together provides, I suppose, actual win-wins, so actual improvements. And what we have here is two scenarios for the United Kingdom, and this is some recent modeling we've been doing. Looking at if you look at sort of the top clustering of lines, the NRPO, this is what happens if the United Kingdom from 2011 through to 2050 tackles air pollution by itself. You see, so the negative life years lost is a saving, and you see sort of somewhere between 4 to 4.6 million life years saved over the course of sort of that period of time up to 2050. That graph obviously extends beyond that. What the line below is, the grey and the blue, are life years saved if we consider both air pollution and climate change together and engage in measures to tackle both of them at the same time. You save up to 7.9 million, and this is sort of our modelling sort of coming through. And so substantial improvements in the health co-benefits available from tackling both of these together. And this is, I suppose, really the exciting part is, yes, tackling climate change is good for public health, and yes, tackling air pollution is good for public health. But some of this new data that's starting to emerge suggests that tackling the two of these together yields far more substantial savings for health, but also then for, in this case, the National Health Service. There are obviously all sorts of caveats and all sorts of problems and ways that you could mess this up. You could swap from coal to biomass co-firing. You could transition too early. You could adversely interact with sort of decreasing electricity generation and at the same time try and electrify your transport fleet and find out that you don't have enough baseload capacity. And so I suppose this study is an ideal study, but perhaps just to give an idea of the scale of what some of these health co-benefits might look like.